Is the mic meant to be on? Do we know? Testing.
It works.
Oh, does it? Okay.
It's connected, right?
Okay, got it, sorry. This is not usual for me. Good afternoon. My name is Raul Garza, and I have the honor of serving as the President and CEO of Aunt Martha's Health and Wellness. And I want to welcome everyone to the city of Chicago Heights, and to this facility, which is the Aunt Martha's Peggy Eisenstein Family Healthcare Center. I also want to thank Governor J.B. Pritzker for his decisive and steadfast leadership in the face of so many uncertainties that have been brought on by the pandemic. I'd also like to recognize and thank Dr. Ezike for her fortitude and her support in leading Illinois' healthcare systems to respond to this disease, this deadly disease. I'd also like to take the opportunity to recognize someone who's not with us today. She does so much behind the scenes and always leads out in front, and that's Deputy Governor Sol Flores, who's such a great advocate for the healthcare and human services industries. And we, at Aunt Martha's, we definitely appreciate her support, her advocacy, and her friendship to us. I'd also like to recognize Senator Patrick Joyce, whose district this clinic is in, as well as Representative Anthony DeLuca, who I've known for close to 30 years. I don't think you'll find a pair of more fierce advocates for their communities, and really not just their communities, but all communities in Illinois. So we are honored today, obviously, and very proud to be hosting the governor, the state legislature, Dr. Ezike, and members of the press. So thank you and welcome to Aunt Martha's Health and Wellness. It was about, it was New Year's Eve when my father was diagnosed with COVID-19. He was immediately hospitalized for 8 days and was released. And I think we all had a sense of optimism, my mom, my siblings, our family, that he would recover. He did not. My father passed away last Tuesday. And when I think about the 4 weeks that he experienced, the physical strain and stress, I think what was probably more overwhelming to he and my mother and my family was the emotional agony that we were overcome with, because we didn't have the opportunity really to be around him during that time. And my father was very, very much a family-centered person. And I think we all know people, whether they're friends or neighbors or family members, that have a similar story where they didn't have the opportunity to be vaccinated. In fact, had he had 2 more weeks, he would have had the opportunity to be vaccinated because he would have been eligible. So how does Aunt Martha's respond to that? And I think the answer probably is consistent for all 50 community health centers in Illinois, who are led by talented and committed leaders dedicated to serving the underserved and unserved communities in the state of Illinois. And so we all stand ready to support what our communities need, to support the governor, to support Dr. Ezike. I'm confident of that. And for Aunt Martha's, I think we especially look forward to go well beyond the 1,500 vaccinations that we've provided to individuals throughout our Aunt Martha's healthcare network. I think we also recognize that there is hesitancy in taking the vaccine, and I certainly have been very vocal around this topic, as well as Aunt Martha's over the last several months. And it's especially true in communities of color, where past misdeeds have created this generational mistrust in communities of color. And I think it's an opportunity for us as community health centers to help bridge that gap. Aunt Martha's is very proud to serve this community because there are communities like the city of Chicago Heights that need our support. And I'm especially proud also that Aunt Martha's, our organization, reflects from the staff that work behind this front desk to our clinical, to our operational, to our executive staff. We reflect the people we're serving, the communities we're serving. And why does that matter? Diversity matters because it creates an opportunity for us to have an impact on an individual that might make the difference as to whether they decide to be vaccinated or not. And so if you're hesitant, I guess my suggestion would be, I urge you to take the vaccine. If you have questions or concerns about the vaccine, call your primary care provider, call Aunt Martha's, call any one of my 50 colleagues who lead those federally qualified health centers in Illinois, and just know that our staff can answer your questions and then also, I think, allay any concerns you would have. Get the vaccine. Do it for yourself, do it for your family, and do it for your community. My father, Raymond Garza, like so many people, did not have the opportunity to be vaccinated. That wasn't granted to him at the point he was in his life. And so I hope that people are able to make that decision. And if we have to have 10 conversations with you, that's what we're willing to do. So with that, once again, thank you. We're honored. And I would like to introduce, it's my honor and privilege to introduce the state of Illinois' governor, Governor J.B. Pritzker. Thank you.
Thank you very much, Raul. Raul, I am so sorry for your loss, and I want you to know I can only imagine that your father must have been tremendously proud of not only what you've achieved, the position that you've achieved of great respect in this community and by the healthcare community, but also, frankly, the kind of person that you are and the people that you serve who care so much about what you have done for them. So I know that you're experiencing tremendous loss, but I also feel the, I guess, optimistic note that your father has left behind a truly good and kind person. Thank you for giving us the tour of this facility today and getting to meet your staff and even some of the people who are getting vaccinated. It is always a good thing for me and a good feeling when I get to see people getting vaccinated. It's one more person, one more note of progress toward the end of this pandemic. This organization, Aunt Martha's, has been doing amazing work. 40,000 COVID tests performed, 10,000 face masks distributed, 25,000 telehealth patients served. You've made an enormous difference for so many residents. So to Audrey Pennington, to Dr. Charles Barron, to Dr. Tamara Lim, Mary Martin, and the entire Aunt Martha's team, I want to thank you from the bottom of my heart for your service, not just to this community, but for the state of Illinois. You may also know, Raul, that we stole from Aunt Martha's our leader of the Department of Children and Family Services, who is amazing. He really is. He took on a job that is so difficult, and I think everybody knows that DCFS had years of problems before I became governor, and we brought him in to really reform the place, and he has already made tremendous progress in that regard, but there's more to do, and he knows it, and he's on top of it. Dr. Ezike and I are here today with Senator Patrick Joyce and with Representative DeLuca, both of whom are leaders in Springfield that truly their colleagues follow and listen to. That's important for the residents of these districts to know about the leaders that they elected. and we're here to celebrate Aunt Martha's work in providing COVID-19 vaccine to approximately 1,500 patients so far. In part because of the team's effective work, Aunt Martha's is also partnering with the DCFS, Department of Children and Family Services, to deliver the vaccine to frontline child welfare workers around Illinois, who are at risk every day as they perform their duties. Aunt Martha's has one of Illinois' largest federally qualified health centers, all of which have been a bulwark in our COVID-19 response, most often serving those most in need. In fact, beginning in March, when we expect increased vaccine supply, just next month, Illinois will start providing a specific increased set-aside of vaccine allocation for our federally qualified health centers as part of our continuing effort to reach those who may not have a primary care provider or who are most challenged when it comes to healthcare access. This is another step in my mission to weave equity into every one of our goals when it comes to the vaccine rollout. I've said since the very beginning that what we can't do is let the vaccine distribution exacerbate inequalities that existed, frankly, long before COVID-19. Inequities that I'm committed and remain committed to eliminating. We need to continue to move thoughtfully through this healthcare crisis to overcome the disadvantages too many people have lived with in our healthcare system for far too long. That's why more than a month ago, when the federal government recommended vaccine coverage for only those 75 and over, I announced that Illinois would allow those 65 and over to be vaccinated, and here's why. While the average white person in Illinois who died of COVID-19 passed away at age 81, the average age at which Black Illinoisans die of COVID-19 is 72. That's below the 75 plus category that the CDC had laid out. And for Hispanic Illinoisans, it's 68 years old. Every way of prioritizing who's next in the vaccine line leaves somebody worthy out. But it would have been especially egregious to only cover those 75 and older when a majority of those seniors most at risk, people of color, would have been left out. Apparently the CDC agreed with us and they changed their federal guidelines to match ours. It's also the case that people with underlying conditions are disproportionately low income and non-white. That's precisely because of the existing structural and generational inequities that I'm trying to eradicate. For example, Black Americans are twice as likely to have diabetes than white Americans. And diabetes is an underlying comorbidity that significantly increases the risk of severe illness from COVID-19. That's one of the reasons that I announced earlier this week that Illinois will be expanding Phase 1B on February 25th, that's about 2 weeks from now, to include those who have high-risk underlying conditions. It's not just an issue of equity, it's also the right thing to do for cancer patients, for those with heart disease, with COPD, and so many other conditions, the people who are most vulnerable. By expanding the pool of those eligible to get a vaccine as our supplies are projected to increase, Illinois is advancing the goals of attaining equity, keeping those most at risk healthy, and reducing new cases, hospitalizations, and deaths. Already we've seen our vaccinated population look more and more like the population of Illinois, especially since we began Phase 1B just 2.5 weeks ago. It seems like so much longer than that, but it was just 2.5 weeks ago. Because of the investments that we've made and the work of partners like Aunt Martha's, Illinois has one of the strongest equity efforts of any large state in the country. But we still have so much work to do, there's no doubt, to ensure that people of color get vaccinated. So we haven't been sitting on our heels. Along with expanding vaccination locations in communities most in need and working with trusted community leaders such as local pastors, Illinois has been reorienting our COVID-19 mitigation awareness campaign to focus on addressing hesitancy and sharing facts in multiple languages, in English, in Spanish, and many other languages. This campaign features real Illinoisans sharing their stories about the pandemic, about vaccine safety, and about why getting vaccinated is a way forward for the entire community. And in addition to our Illinois National Guard Vaccination Assistance Program, we've brought in federal disaster teams to help us better reach underserved communities and vulnerable populations as we move forward in our vaccination plan. Yesterday, we announced hundreds of additional Walgreens stores that will receive vaccine directly from the federal government now. Locations of those stores were selected based upon their proximity to socially vulnerable and medically underserved areas. Overall, we now have more than 850 vaccination sites statewide. And we'll continue to update our coronavirus.illinois.gov website with the latest vaccination locations. Again, that's coronavirus.illinois.gov. Today, there's even more good news. I'm happy to report that our statewide vaccinations yesterday reached a new record of 95,400. That beats our old record by 20,000 a day. Illinois has now further solidified its position as the best among the top 10 most populous states for per capita vaccinations, now 2 weeks in a row. Making an appointment is still, no doubt, a frustrating effort that requires enormous patience. But we still have not received enough vaccine from the federal government for everyone who's eligible in Phase 1B. However, more people will be receiving their second doses and be fully vaccinated as we reach the third week after the beginning of Phase 1B, at which point those who received their first shot of the Pfizer vaccine will get their second shot. And then a week later, those who received their Moderna shot 4 weeks earlier, will get their second shot. In recent weeks, we've been increasing our vaccine supply. We've seen that increase coming from the federal government, thank goodness. Nearly 30% more on a weekly basis since the beginning of the new administration in Washington. And I have great hope that the Johnson & Johnson vaccine will be approved at the FDA's February 26th meeting. That's one day after those who have comorbidities will be allowed in Phase 1B. This coming week, providers around Illinois, excluding Chicago, can expect about 365,000 doses coming from our weekly federal shipment and our local inventory. That's a significant increase from where we were just 1 month ago, and once again, because the new administration has done a terrific job of increasing the supplies to the states. Each shot brings us one little step closer to putting this pandemic behind us. So in the meantime, everybody, let's mask up, let's keep fighting. And now I'd like to introduce our terrific leader of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Good afternoon and happy Friday, everyone. I am so excited to be here at Aunt Martha's. And sir, again, please extend my condolences to your family, your mother. This is one of our leading federally qualified health centers, and they will be critical to our vaccination effort as we move forward, as will all of our FQHCs. We've been hard at work building a robust vaccine infrastructure with hundreds of sites across the state. But until the vaccine supply from the federal government increases, vaccination appointments will be scarce. So we're asking people that dreadful word, but we still have to say it, patience. We know many providers who are ramped up, ready to vaccinate. They are requesting tens of thousands of vaccine, but we can only provide what the federal government has allocated to us. This is one of these situations where it's not like credit card spending where you can give something you don't have. So we are giving all that we can. It's not enough to meet the demand, but we will continue to get it and give it, and we appreciate all our partners who are participating in this tremendous effort. We must ensure that the vaccine is distributed in an equitable way, and that's equitable with respect to our seniors, with respect to geography, and of course, with respect to race and ethnicity as well. An undeniable fact is that the minority populations have been disproportionately impacted by COVID-19. And we don't want to see growing disparities in the people who are vaccinated. The good news is, as the governor mentioned, that as more people become eligible and as more community engagement and people get the right facts about the vax, more communities of color are getting vaccinated, and we're getting closer to being they are getting closer to being appropriately represented, but there's room for improvement. While Illinois is doing better than the other large states, we have always and will continue to set our own benchmarks and not be satisfied until we are getting the vaccines into all of our communities throughout the state. We continue to work with local health officials across the state to set up vaccination locations in socioeconomically disadvantaged communities and in communities of color. We will continue to host town hall meetings across the state to talk with minority communities. We want to dialogue and directly answer questions about the vaccine. Again, sharing the facts about this vax. And those facts are that we have safe and effective vaccines. Many people often ask, what should they expect after being vaccinated? And like anything else, and with other medical therapies, there can be different effects to different people. But many have reported side effects such as those normal signs that show that your body is actually building the protection. But if you don't have severe signs, that absolutely is also the way that it can go. We are also asking those who have been vaccinated to continue taking the precautions that we've been talking about since the beginning. You still need to cover your mouth and your nose with a mask or face covering when you're around others. Still need to avoid crowds, still need to keep the 6 feet of distancing, still need to wash your hands regularly or use hand sanitizer. Testing also remains a vital part of putting this pandemic behind us. While a lot of the focus is on the vaccination right now, we can't forget the importance of testing. So as a reminder, if any of you were having some Super Bowl party gatherings, it's the time now to get tested if you haven't already. Don't say because I haven't any symptoms, that means I don't need to be tested. We know that nearly half of people can be infectious and not show a single symptom. So please do the responsible thing and get tested proactively. Identifying and knowing quickly if you have COVID-19 can cause us to identify close contacts more quickly. And that's how we will slow the spread and stop a dreaded third wave. In the last 24 hours, more than 103,000 COVID tests were reported for a total of over 17 million tests across Illinois. In the hospital, 1,915 individuals were in the hospital with COVID-19, and of those, 437 were in the intensive care unit, and 211 were on ventilators. Today, 2,598 new individuals were diagnosed with COVID, and that takes our statewide total since the beginning of this pandemic to 1.15 million total cases. Over the last 24 hours, we received reports of 32 individuals who lost their battle with COVID, for a total of 19,873 individuals that have lost their lives here in Illinois. I've said it many times before that the only way this pandemic will end is if we work together. To reach herd immunity, all populations need to be vaccinated, not just some. We all need to wear our masks, we all need to avoid crowds, and we all need to participate in testing so that we can reduce the amount of virus circulating, and that does slow down the mutation rate, which creates these new variants. I am wishing everyone a happy Valentine's Day weekend, and in that spirit, please remember, let's spread love and not COVID. Thank you. Now I'll summarize points in Spanish. Buenas tardes y feliz viernes. Estoy muy feliz de estar aquí en Aunt Martha's, uno de nuestros principales centros de salud calificados a nivel federal, que será fundamental para nuestro esfuerzo de vacunación aquí en Illinois. Hemos estado trabajando fuerte en la construcción de una infraestructura robusta de vacunación, con cientos de sitios en el estado. Pero el número de vacunas del gobierno federal tiene que aumentar, mientras las citas de vacunación serán pocas. Por eso pedimos a la gente que por favor tenga paciencia. A medida que más personas se vuelven elegibles para vacunarse, vemos que un mayor número de nuestras poblaciones de color están siendo vacunadas, pero necesitamos que más de ustedes se vacunen. Como vimos comunidades de color afectadas de COVID-19, también estamos viendo disparidades en la vacunación. Por eso pido a la gente afroamericana y Latinx que cuando se presenta la oportunidad, por favor, se vacunen. Yo me vacuné hace más de una semana que recibí el segundo dosis. Muchas personas me preguntan qué deben esperar después de vacunarse. Es posible que tenga algunos efectos secundarios que son normales de que su cuerpo está generando protección. Sin embargo, después de que se vacune, no significa que ya no necesite tomar precauciones. Deben seguir a cubrirse la boca y la nariz con una máscara cuando está cerca de otras personas. Evitar grupos grandes. Mantenerse al menos a 6 pies de distancia de otra gente y lavarse las manos con frecuencia. En las últimas 24 horas se han informado más de 103,000 pruebas de COVID-19 fueron hechas para un total de más de 17 millones de pruebas en Illinois. Durante la noche, 1,915 personas estuvieron en el hospital con COVID-19. De ellos, 437 personas estaban en la unidad de cuidados intensivos y 211 pacientes estaban en ventiladores. Reportamos 2,598 nuevos individuos con COVID-19 para un total de 1.1 millones de casos en Illinois. Desde ayer hemos recibido informes de 32 personas adicionales con COVID-19 que han fallecido por un total de más de 19,800 vidas perdidas. Lo he dicho antes, la única forma en que esta pandemia terminará es si todos trabajamos juntos. Para alcanzar la inmunidad colectiva es necesario vacunar a todas las poblaciones, no solo a algunas. Todos debemos usar nuestras máscaras y evitar grupos grandes para reducir la cantidad de virus que circula aquí en Illinois. Feliz Día de San Valentín. Difundir amor y no COVID. Gracias para su apoyo. And with that, I will turn it over to Senator Patrick Doyle.
Thank you, Dr. Ezike. I'd like to also thank the Governor Pritzker and Representative DeLuca to join us here on the tour of Aunt Martha's. Raul, I'd like to extend my deepest condolences. Your father's tragic death needs to be an inspiration and a drive for us to get everyone vaccinated and to move forward. This is the hardest time. We as Illinoisans have worked hard. We have made great sacrifices. We have followed the protocols of social distancing, wearing masks, and washing hands for what seems like an eternity, but we are right there. I participated in a lengthy Senate hearing yesterday on the challenges we are facing on the vaccine rollout. I left the hearing with optimism that we are heading in the right direction as a state and as a country. I beg you for patience. Facilities providing vaccines like Aunt Martha's here in Chicago Heights are becoming more prevalent. Our state's allotment of vaccines from the federal government are growing. I applaud our county health departments who stand at the ready. I applaud the governor and Dr. Ezike and their teams for fighting for as many vaccines as Illinois can get. Illinois is quickly becoming one of the leading states for vaccine distribution in the country. Yours is coming. Stay on course on COVID-19 protocols. To the healthcare workers, the grocery store employees, small business owners, residents, and the millions of others who have made sacrifices during this pandemic, thank you for your continued service to your community. There is a light at the end of the tunnel. Let's keep moving forward together. And with that, I'd like to reintroduce Governor Pritzker to answer any questions.
Thank you. Thank you, Senator. Happy to take any questions from members of the media.
Good
Yes.
afternoon, Governor. Let's start with the big question in everyone's minds. Part of your expansion of the comorbidities into phase 1B will require more vaccines. You did allude to additional federal supplies, but where are those going to come from, given the fact that you're expanding the number of people exponentially with regard to that?
Well, it's not exponential, but yes, there's an expansion of 1B. 2 weeks from now, as you know, is when that will begin. So that's 2 weeks hence. You know, supplies have been growing steadily since January 20th when the new president took over. New people have been put in charge. I must say that we have a weekly call, all the governors, with the leaders of the COVID-19 task force. It's vastly different than it was just before the new president came in. February 26th, I think this is something, you know, on top of the doses that we're receiving that are in an increase each week, we also are seeing on February 26th that Johnson & Johnson's vaccine is going to come before the FDA, and there's a great deal of optimism that they'll get their emergency use authorization, and therefore we'll be able to begin to get those vaccines added on top of Pfizer and Moderna. Last thing is, the federal government announced over the last 48 hours that new vaccine shipments are going, in addition to the ones coming to the states, they're actually going directly to the FQHCs and to pharmacies. In Illinois, you heard yesterday that Walgreens will be getting an additional large amount of vaccine, and that amount will be increasing. Very helpful to all of us. We want to make sure this gets distributed, particularly focused on communities that have been left out and left behind. FQHCs do a terrific job of serving those communities. So do the locations that Walgreens has chosen for those doses to be administered.
Before you move on, because this is following up on the 1B issue
Sure.
and the expansion of it, why make that decision when immediately following your announcement, there are massive Chicago, Cook County, who took a step back and said, we're not going to do that plan. So what's your response to that? And what is the wait time right now, too, for 1B? Because that's their concern, is that it's just not happening because of the vaccine. There's not enough of it.
Well, once again, that expansion doesn't take place till February 25th, and doses have been increasing, and Johnson & Johnson, again, coming online that week. But let's step back for a moment and remember who we're talking about. We're talking about people who are the most medically vulnerable. These are folks whose immunosystems have been suppressed, people who've had cancer or have cancer today, people who have sickle cell anemia, heart disease, diabetes, who suffer much more severe consequences of COVID-19 than people who don't have those conditions. I didn't want to wait any longer, but of course everybody is having to wait because there just aren't the vaccine doses available nationwide. It's not just an issue in Illinois. But if you look across the nation, when ACIP, the CDC committee, made its recommendations, it particularly focused on expansion to those with comorbidities, those conditions that I was just highlighting. So we want to make sure that we're providing it for those folks. We want to make sure that we keep up with the increase of vaccine doses that are being sent to the states too, increasing the number of people and the number of doses at the same time. So we feel good about the opportunity to serve those folks. Remember, one other thing to keep in mind is that, unfortunately, about 1 in 2 people that get offered the vaccine are choosing not to get vaccinated. Now, we're working on changing that. We're working on increasing the likelihood that someone who is hesitant will get vaccinated. But so when you look at a category, you have to kind of say, you know, cut it roughly in half or by 40% or 50%, just to make a count of who's likely to want to get vaccinated early in the process. As you know, we're going to be vaccinating people all into the summer, you know, and into the late summer. That's the likelihood anyway, because there's so many people to get vaccinated. And of course, the healthiest people among us will get vaccinated behind the people who are most at risk.
Question from a lot of people in the pool, and perhaps Dr. Ezike is the one to answer this. Some of the comorbidity classifications are vague, including the one for obesity. What are the classifications for obese comorbidities with regard to the vaccine and the expansion?
So we are following the ACIP guidelines, which suggest that for moderate and severe levels of obesity. And so for healthcare providers, we know that that's a certain BMI. That BMI range, you know, over 30 is obese, but when we think about 35 and 40, that gets into the more moderate and severe stages. So there are those classifications that exist, and so that is what we're going to be following.
How will that be determined at the vaccination sites?
Right, so there are some logistical challenges. It's very easy to figure out through an ID who is over 65. And so we are working, you know, when we're working with an FQHC, when you're working with, you know, your regular clinic, a hospital system, they have that information. And so that is a logistical challenge that we're trying to work through. We understand that we need people to, you know, be honorable. We need people to be able to assert or testify that they are who they say they are, that they do qualify based on the criteria that is actually being required. And so there is going to be some attestations that people are certifying. In some places they will maybe have to sign, depending on the location. But it's very important that people are not trying to misrepresent any information, and that we realize that there are people who absolutely need this vaccine more than another person. And even though we all want this and absolutely all would benefit from getting it, we have to think of our neighbors and think of the seniors that need to get vaccinated, the people with real conditions that need to be getting, and not use loopholes to try to circumvent and jump ahead of the line. So we are counting on people to do the right thing. This is an all-in Illinois approach. And as we follow the data and see what's happening, we'll see if we need to do something more stringent.
Can you talk about, Dr. Ezike, the federal health centers too, like this one, and the allocation of the vaccine itself? Because the CDC is saying this is a separate allocation to these health centers. So can you clarify that? Because I want to make sure that, is it the Illinois supply that's getting taken here, or is it an entirely different supply that's being brought to these?
Correct. No, I understand why that would need clarification. So as it has been standing now, we have the IDPH gets our allocation, and then we share it with our local health departments. And then the local health departments can see within their jurisdiction who are the FQHCs or the hospitals, or are they going to do the vaccination themselves, and then they apportion it to different groups in their local jurisdiction. We now are excited to hear the partnership that's happening directly with the federally qualified health centers, where the government, the federal government, will give from a separate supply, not to be cut from Illinois' allocation, a separate. So this is on top of an and, not an instead of or an or. This is on top of what Illinois gets. They will be giving directly to federally qualified health centers. Now that's going to be rolled out slowly, and so it's not every FQHC that will get it immediately, but that's going to be the process. And so as we identify the FQHCs that are getting direct allocations, that allows more doses for the local jurisdiction to allocate within their communities.
So how many federal health centers will start February 15th in Illinois?
Yeah, so I think in the list that has been identified, I don't think we have a location that's designated in that first, and so we'll be waiting for subsequent rollout to get our institutions, our FQHCs in that mix.
St. Martha's doesn't start on Monday? No? Sorry.
Aunt Martha's does have vaccine, so they have already been allocated vaccine, and so they have already done over 1,500.
Not from the federal government, from the state.
From the local.
county, rather.
State.
Yeah,
From
So
the local.
You're not on the list for the federal ones yet? Is what I hear you
Not at
saying.
this time, not at this time.
Not in the first week. And I would just add one other thing, though. There were two announcements, and they really were side by side. Sorry. One of them was about direct shipments to FQHCs. The other one was direct shipments to Walgreens, in the case of Illinois, for those. And Walgreens has identified those underserved communities, so serving many of the same types of populations that FQHCs serve. Those doses are coming. 39,000 is the first number that they're going to get for those additional locations that Walgreens will serve. And again, those do not come out of the allocation to the state of Illinois that we provide for all the local health departments. So those are in addition.
And then on another note too, with education, obviously the CDC and President Biden's plan is going to be released as we speak, as a matter of fact. Do you want to respond to that and how the phasing in, it sounds like it's going to be, and what your stance is on all of this too, as you see these new guidelines?
Well, I haven't seen the guidelines, if they've been issued this morning, new guidelines, but I will tell you that in Illinois, that I have been insisting that we get kids back to school as soon as humanly possible. And we've left it up to the local school districts. We've given them guidelines and the capability to make their schools ready for in-person learning. Some schools have chosen, because of the level of infection in their area, to remain all remote. Some have chosen to be hybrid. Some are fully in person. But those are decisions that are being made at the local level, in part because the facilities in which those kids are going to school, the schools themselves, are so much different one from another, and it's really not a one-size-fits-all for the state to demand that everybody go back to school. We want to make sure they go back as fast as possible. We've given them resources and guidance about how to get that done. And we've had that out there for, 6 or 7 months already.
Governor, a question from Jenna Barnes over at WGN. She says, given the federal government's purchase of 200 million vaccine doses, when can anyone in Illinois who wants a vaccine reasonably expect to get them?
I couldn't answer that question, in part because you have to remember that there are three populations of people in Illinois relative to vaccinations. The first is people who want it right now. They're ready to take it. If you offer it to them, they'll take it. And that's about 40%. But another 46% have some, hesitation for, a range of reasons for those hesitations. 46%. So those folks are not standing in line immediately, and we don't know exactly when they'll decide that they want to get vaccinated. But Raul and I and Dr. Zike and so many other people in our campaign to try to convince people to come, that will affect that number, I think. And also just getting to know people who have already been vaccinated and hearing it's no big deal and it's going to make everybody healthier. Then there's a third category of people, about 14%, who say they'll never, ever, ever take the vaccine. They don't want it. They're never going to line up for it for one reason or another. So we're not trying to convince those 14% now. There's a lot of communication. They will see some of that communication, but we're really focused on trying to get the vaccine hesitant to make sure that they step up. But so trying to guess exactly when is it going to be that anybody who on a given day wants to get vaccinated can, it's a hard notion to get your arms around because the numbers change all the time as we convince more and more people to be, to want to go get vaccinated.
Apart from just saying be patient, do you have any specific advice for those people who are going to have to wait?
Yes, we say it over and over. I know you've heard it many, many times, but it's very important for people who have not been vaccinated, I'm one of those, to wear a mask, to maintain your social distance, wash your hands, all the things that you've done throughout this pandemic. I do want to point out that Illinois is, our case numbers, our positivity level is at a level that we've not seen since last summer. And so it's very good. That doesn't mean everybody can toss their masks aside. But my point is, if you do wear your mask and you haven't been vaccinated and you do wear your mask and maintain social distance, you're in a very good place to not get COVID-19.
In New York, it's reported that the governor is considering opening sports stadiums with capacity restrictions. Are you considering doing the same thing?
Well, I'm going to turn to the doctors at IDPH, honestly, for the best advice, because that is not a political decision. I do not want to create super spreader events if that's what that would do. But, you know, we're going to, hopefully, as things get better and better, we're going to be able to provide more capacity, less capacity constraints for facilities. And I know that we're already doing that, as you know, as people moved back from Tier 3 to Tier 2, Tier 1, and now the entire state in Phase 4. So, you know, let's keep at it. Let's get everybody vaccinated. Wear your mask until you get vaccinated. We'll all get through this safely.
A question from Shelby Bremer on our web team. She asks, with the news about the census data potentially being released too late to redraw maps by the deadline set by the Illinois Constitution, do you support redrawing the maps using old data, or how do you plan to approach the process?
We're looking at that now. Obviously, that announcement was just made over the last 12 hours, I believe. We're looking at how we might manage through that. It's obviously extraordinarily difficult. It was one thing when they said April. It's another thing when they said September. It really creates a challenge for us all. But we'll get through it. We'll deal with it like we have all the other challenges through COVID-19.
Can I ask you about, and it kind of is following Dr. Ezike here, the vaccine line jumpers, if you will. I mean, has this become, you made such a passionate plea about it, Doctor. I just want to know, how big of a problem is this? How big of an issue is it right now that people are checking the box and then they show up and nobody's checking, and you know what I mean? Like,
We haven't had, look, the local public health departments and those who are, I'm sorry to interrupt, by the way. The local public health departments and the other providers have done a pretty good job of making sure that they're vaccinating people who appear to be, you know, eligible in that category, et cetera. You know, they're filling out forms in the process when they go to their healthcare provider. So we have a pretty good idea, mostly, of who's getting vaccinated, whether they're in the right category and they're supposed to get vaccinated. Are there line jumpers? I'm sure there are. We have not gotten big reports, massive reports of line jumping. Local public health departments know they too want to get their local folks vaccinated as quickly as possible, those who are most vulnerable. And those are the ones that are in these categories that the CDC has highlighted.
All right, thanks everyone.
Thank you.
Thank you.